So much, Ms. Shweta, for sharing the slides. So hello and good morning to each and everyone present here. And of course, good afternoon to Ms. Fong and Ms. Lam, our resource persons. So I am Ms. Rajlakshmi R. Vignesh, alumni of Hashu Advani College of Special Education. And it gives me immense pleasure to welcome all of you back to the second session of day 2 of the International Interdisciplinary Online Conference on Assessment and Diagnostic Practices for Specific Learning Disabilities, a cross-country perspective organized by CCYM's Hashu Advani College of Special Education. Before I proceed further, please note that we have started the recording now. This is purely for academic purpose with no commercial agenda. The organizing committee has obtained the permission of the resource persons for the same. So in the words of Sir Nelson Mandela, education is the most powerful weapon which you can use to change the world. And it is indeed very, very true. Hence, keeping this thought in mind and to continue with the quest of never-ending education, all of us have gathered here to learn and understand more about the latest practices for specific learning disabilities in 7 countries. The last session briefed us about the assessment and diagnostic practices for specific learning disabilities in India. And now in this session, we will learn more about the assessment and diagnostic practices for SLD Singapore. And we have 2 wonderful and learned resource persons to educate and brief us on the same. On behalf of everyone present here, it is my honor and privilege to welcome Ms. Fong and Ms. Lam from Singapore. Let me take this opportunity to introduce both of them. Ms. Fong started out at the Dyslexia Association of Singapore as a specialist psychologist in 2012. Since then, she has completed the Master of Arts in Applied Psychology program and is a registered psychologist with the Singapore Psychological Society. Ms. Fong is currently the Assistant Director of the Spld Assessment Services at the Dyslexia Association of Singapore, a team that provides a one-stop psycho-educational assessment service. She also facilitates the placement of students in learning programs at the DAS. She also conducts psycho-educational assessments for individuals who experience difficulties with learning. Welcome, Ms. Fong. Ms. Lam joined the Dyslexia Association of Singapore Spld Assessment Services team in 2020 as a specialist psychologist. She conducts dyslexia assessment services for children and youths and provides customized recommendations to boost them in their educational journey. Ms. Lam holds a Bachelor of Psychological Science honors from James Cook University. She believes in the unique strengths of every individual and seeks to bring out the best in each child. Welcome, Ms. Lam. So I welcome both of you. I now hand over the stage to you, and all of us are eagerly waiting to hear and learn from both of you. Over to you, ma'am.
Okay, thank you. Thank you very much for the introduction. Just let me share screen.
Sure.
Okay, there we have it. Okay, so everyone can see my...
Yes, yeah. We can see, ma'am.
Good. Okay, so thank you very much for the invitation to speak today. I guess we are very excited to learn from everyone as well. And we just also want to take the opportunity to share what we do at the Dyslexia Association of Singapore. Okay, so so thank you so much for the earlier introductions. I think we will just add on a little bit more about ourselves. All right. So so here with me today. So my name is Pei Yi, and here with me today is Esther. Esther, you want to share a little bit?
Sure. Thank you so much, everyone, for the introduction. So my name is Esther, and from what you heard previously, I've joined the DAS as a specialist psychologist in 2020, so just last year. What I do here is I conduct psychoeducational assessments for school-going children. So we see kids as young as kindergarten to primary, secondary school ages, and I typically assess them for dyslexia.
Okay, so then now it's my turn. My name is Pei Yi, and as introduced earlier, I'm the Assistant Director of the Spld Assessment Services team in the DAS. I am also a registered psychologist here. I'm definitely much older than my younger colleague over here. So similar, because our service is mainly for the conduct of psychoeducational assessments for preschoolers all the way to working adults. For me, these are the range of assessments that I conduct, apart from the other kinds of work that we do. So I will just share a little. I'll just go on to share a little bit more about us. So to provide a little bit of context, okay. So here's an overview of what we'll be talking about today. We will be looking into an introduction to the DAS, or the Dyslexia Association of Singapore, and also a little bit about the SAS, which is the Spld Assessment Services within the DAS. Later on, and subsequently, Esther will bring you through some information about screenings that we do here at the DAS, and then I will take over and talk about the psychoeducational assessments that we conduct, and then we will end off with Q&A as well as a case study. Okay, so just wanted to explain a little bit within. Of course, we are situated in Singapore, and there are some guidelines that we follow, but there is also some variation in the practices and the types of work that psychologists do in Singapore. So what we will be going through today is really focused on what we do at the DAS. Okay. And if there are any questions, please note them down, and we will certainly try our best to address them at the end of the presentation. Okay, so moving on, just some introduction about the DAS. So our vision is helping dyslexic people achieve. So our name is as in our name, dyslexia is in our name. So really that is the focus of our organization. And we do aim to be a world-class organization dedicated to helping dyslexic people and those with specific learning differences in Singapore achieve. So how do we do this? We provide assessment services, and there are various learning programs for students, for them to overcome the difficulties that are brought about by dyslexia. All right. Okay. Right. Okay, so now a little bit more about the Spld assessment services. We started way back in 2002. The SAS initially was actually called just the assessment service at the DAS, and we really focused on conducting assessments for dyslexia only. Okay, so that was so we have a long history in conducting assessments and specifically thinking a lot about dyslexia. So back in 2017, we expanded our service somewhat to conduct assessments for a range of learning difficulties in addition to dyslexia. So things like dyscalculia, ADHD, ASD as well. Okay, and so apart from that, we are also involved in dyslexia-related research at the DAS, and we also conduct training sessions and talks to support professional development as well as raise awareness about dyslexia and other learning difficulties. Okay, so that is the gist of the SAS. Okay, and I think this I'll linger a little bit on this slide. Just wanted to explain a little bit about the types of the people who make up our team and get us and move us along. Okay, so so first of all, we have registered and specialist psychologists. Okay, so for registered psychologists, so okay, so there was a little bit of interruption, sound. Okay, so maybe we can, I'll start with specialist psychologists first. So for many of us, we are recruited first as specialist psychologists when we are fresh out of our bachelor level studies. So in Singapore, we do have those who are bachelor level psychologists, and they have to work pretty much work under the supervision of like a registered psychologist in order to conduct the assessments and to ensure that that they are adequately supported in terms of evaluation of cases, administration of tests, etc. Okay, now I'll go into more of the definition of the registered psychologist. So those are psychologists who have attained master level qualifications in applied psychology, and they have clocked a certain number of hours to be able to meet the requirements to attain registered status with different registration bodies. So in Singapore, we have the Singapore Psychological Society, as well as the Singapore Register of Psychologists. So after accumulating the hours and meeting the requirements, and also spending a couple of years in school, that's where the psychologists usually end up in Singapore. Okay, so some other people that we have that support our service at the SAS are referral reading officers, and these are our colleagues. These colleagues are in the focus more on the processing of the referrals, as well as doing a little bit of screening and things like that. Okay, we also have our student services officers, so they are our administrative colleagues, and they help with our supporting our service, making appointments and things like that. Okay, so this is just like a reiteration of what I mentioned just now verbally. So specialist psychologists they have a bachelor degree in psychology. They at the DAS, they receive in-house training to conduct assessments, and for as long as they are conducting assessments at the DAS, they are supervised by registered psychologists who have a master degree in applied psychology, and they will supervise specialist psychologists and guide them along in terms of case conceptualization and things like that. They also conduct the training for specialist psychologists when they are first recruited. Okay. All right, so we have a little bit of definition earlier about the types of psychologists in at the DAS, and this is also actually the types of psychologists is also reflective of the types of psychologists that are present, in Singapore, the broader Singapore. Okay, so now I will go more into the definition of special educational needs. Okay, so for us, we have we are guided in our professional practice by professional practice guidelines that are set out by the Ministry of Education. So and what has been stated is that someone with special educational needs, or SEN, has a disability and displays greater difficulty in learning as compared to a majority of their peers. They have difficulty in accessing educational facilities catered for the majority, or they have some areas of impairment, whether is it social, academic, physical, or sensory functioning. All right. Finally, they also require different or additional resources beyond what is conventionally available in mainstream education. So, so you can see that the definition here covers it's quite detailed, and it's what we look at when we term students with special educational needs. So, of course, they are further differentiated into mild and more severe type. So for learning difficulties such as dyslexia, which is more specific in nature, they are termed as mild SEN, as opposed to more general learning difficulty. So that one might be intellectual disability, etc. Okay. So, we have some definitions that we that guide us in our practice.
Sorry to interrupt you, but can you be a little louder?
Oh.
In a request, maybe you could come closer to the mic.
Sure. Is this better?
Yes, definitely.
Okay, very good.
You can turn off the video so that you can be closer to the mic if there is connectivity and those issues.
Oh, no, it's not a connectivity issue. My mic is just like lower down. I brought it higher. Yeah. Okay, thank you so much. But I don't know, was it okay? I think, do you manage to catch what I said just now?
Did not repeat it. It was just soft. So
okay, sure.
So if you can be louder and little slower, it would be just good.
Okay, no problem. Yeah.
Thank you and sorry.
Okay, so so basically, just to summarize with a little bit more clarity and volume, so some of the main terms that we are looking at here are the types of psychologists that conduct psychoeducational assessments, and also the definition of special educational needs lah. Okay, all right. I think next up we have screenings, and Esther will take over for a bit.
So I'll just be sharing a little bit more about the screening processes that we do here. At the DAS, we conduct dyslexia screenings as well as assessments. But interestingly enough, to the surprise of many people, they are not the same thing. So if we look at the next slide, we'll see that we have laid out some differences between the screening and the assessment processes. So a screening is similar to taking a snapshot, a photograph of an individual's performance in a few areas that have been found to be implicated in dyslexia. It's a rather short process, just 15 to 30 minutes. And by the end of it, you can expect to receive a simple risk index for dyslexia. For example, low risk, moderate risk, high risk. It's easy to interpret. On the other hand, an assessment, we liken it to using a microscope to study all the other details that contribute to an individual's learning ability. It's a much longer process because it uses standardized tests to measure more areas of an individual's abilities and achievements so that we can arrive at a diagnosis. At the end of the process, a detailed assessment report will be generated, and this report will require professional interpretation. So we do emphasize that screening should not be regarded as a substitute for a more comprehensive assessment. Even if an individual is found to be at high risk of having dyslexia during the screening process, it's not equivalent to him having received a diagnosis of dyslexia. So a diagnosis can only be confirmed through a psychoeducational assessment. Okay, so I'll walk everybody through the two types of screenings that we do here at the DAS. The first type is a mass screening. So prior to the COVID pandemic, the DAS conducted mass screenings in our various centers across the islands throughout the year. During this screening, we use a 15-minute computerized test, and it's presented like a game. So in the game, it will look at their skills in a few areas, some phonological components. And after the test, the parents of the children who come for the screening will be assigned to one of our trained staff who will go through the results with them. Depending on the results of the screening, as well as the concerns of the parents and the teachers, the child may be referred to go on for a psychoeducational assessment. The second type of screening that we do is individualized screening. So students are seen for a one-to-one session where we use selected subtests of a standardized test to measure a few areas of their abilities as well. Only our in-house psychologists will be able to conduct this individualized screening. After the test, the psychologist will also go through the results with the parents. And once again, depending on the results of the screening, as well as the concerns that are raised, then the child may also be referred to go on for a psychoeducational assessment. Okay, so I'll hand over the time to Pei Yi, who will go through the assessment process.
Okay, thanks, Esther. Okay, so I'll just go into a little bit more detail about the psychoeducational assessments that we conduct at the DAS. yeah, I guess I'll let the slides guide me as well. Okay, so what is a psychoeducational assessment? To us, it's a comprehensive and holistic information gathering process, and to answer a referral query and to understand more about the child's learning and developmental concerns, and also to find out about a student's strengths and needs. Okay, so this is so it's more than just a test, and really it's we are trying to understand more from the parents, the teachers, as well as the child themselves, the children themselves, to find out more about how they are learning, and in order to make recommendations. Okay, so why is an assessment important? So for us, we believe that every individual is unique, and illustrating using the iceberg kind of analogy, we use the assessment to look beneath the surface. Okay, so no two children are alike. Some children who present with language difficulties, it might be due to various things. It might be due to language weaknesses and inherent language concerns, or it could be something that is more environmental in nature. Okay, so what we want to do with an assessment is to ascertain a diagnosis, if any. Okay, apart from that, we want to understand the child's or the student's underlying issues. We want to profile the student's learning ability, and this could help us with educational planning. So making decisions about schooling, making decisions about the kinds of strategies that might work for the child, and also a good starting point to kind of understand where the child is at that point. Okay, so at the SAS, what do we assess for? So certainly we cover dyslexia, dysgraphia, and dyscalculia. So these are what we term as specific learning difficulties. So they are more in the area of the area of difficulty itself. So for dyslexia, it will be reading, spelling, and writing. Dysgraphia is more in the area of writing, written expression, and of course dyscalculia is more in the area difficulty in the area of mathematics. Okay, so apart from that, we do assess for neurodevelopmental disorders or behavioral disorders such as autism spectrum disorder, as well as attention deficit hyperactivity disorder. Okay, and next up, we also assess for intellectual disability. There are some students who come by, and we find that their learning difficulties are beyond a specific one and a bit more general in nature. So then we would do the necessary. Okay. Apart from that, we have school readiness assessments. Those are for preschoolers, and if say parents are concerned about their ability to access mainstream education or their readiness for mainstream school, so we will conduct school readiness assessments to kind of understand whether we want to recommend the child to go forward. Finally, we may assess for giftedness as well, but this is very, very rare, and but it's really an assessment of their IQ. Okay. Okay, so just wanted to point out that there might be other difficulties such as dyspraxia, but we don't assess that at the DES. For dyspraxia, it's more of a motor difficulty. It's more motor in nature, and we therefore would refer to maybe an occupational therapist who might be able to conduct more appropriate tests for such difficulties. Okay. All right, so a little bit about the assessment process. Okay. So we would conduct interviews, we would collect feedback from teachers, and speak to the parents as well as the students themselves. Okay, try and understand a little bit about the background. What are the concerns that are being identified, and what are some of the learning and educational history of the student. We would conduct an IQ test. Okay, so that would be a cognitive test, And later on, I'll touch briefly on the test that we use. Okay, and then next up, we will do a measurement of academic skills. And if we may make observations of behavior during the assessments, but we might also do direct observations and measurements of behavior, such as in ASD as well as ADHD. Okay, so what do we get out of the assessment? We will establish an individual learning profile for the student, and we may make some diagnosis of learning difficulties if it is present, and we also want to understand the weaknesses that underlie the difficulties that are being presented. Okay, so what are the recommendations that we may make following this establishment of the profile? We may recommend for intervention. So say if a child is diagnosed with dyslexia, we may make recommendations for the child to attend intervention programs at the DAS. We may also suggest referrals to external agencies who can support in other areas of weaknesses. Okay. Next one, we might also suggest accommodations. So things like in the classroom and at home. So students may benefit from things like having teachers allowing the students to take their work home to complete. They may be allowed to, maybe we might suggest for students to be able to have tape recorders in the classroom to ensure that they've gotten everything so that they can review it at home. Also, we might make recommendations for access arrangements during examinations. So this might come in the form of extra time during the examination, a reader, a prompter. However, all these are made based on the child's learning profile, and if the accommodation itself does help the child perform at a level that is more in line with their potential, then that is what we would suggest. Okay. Some other things we might suggest are further assessments. So maybe someone was referred to us for a learning difficulty assessment, but through the process of the assessment, we find that actually the learning does not seem to be the main concern. It's either behavioral or emotional. Then we might suggest for further assessment to understand what are the true underlying issues. Okay. We may also suggest for learning strategies that can be done in school and at home. Those might be useful for parents to learn and to be able to practice at home. Okay, so that's overview of the assessment process. Okay, the testing session per se. So just now we covered the overview, but there is this element of conducting this part where we are conducting the test itself. Okay, and I will focus more on the assessment of dyslexia and the test that we do. So we will dedicate about 1.5 to 2 hours to conduct an IQ test. And then the next 1 or 2 hours, we will be doing tests in the areas of reading, spelling, and written expression. So we will cover a range from single word, kind of like word reading, pseudo word decoding, where students read like words one at a time, and we'll do spelling as well as, and it will go to a range of passage reading as well as essay composition, sentence writing, etc. So there is a range from basic to more advanced literacy skills. And because dyslexia is predominantly a phonologically based difficulty, we will do an assessment on phonological processing as well. So things like blending, rhyming are very common things that we might do. Okay, and also rapid naming. So things like to measure rapid automatized naming. So in total, the assessment testing session might take around 3 to 4 hours. Okay, and this is excluding the interviews that we conduct with the parents as well as the debrief sessions that we share with parents the outcome. Okay, some of the tests that we use. Okay, so like I mentioned, we do an IQ test, and one of the common kinds of test kits that we use are the Wechsler Intelligence Scale for Children, 5th edition, or the WIS5. So we find this pretty useful, even though currently the norms that we are using are UK and US based norms. Okay, Next up, we would take a lot of subtests from the Wechsler individual assessment test. So the Wired currently is the Wired 4. So previously we've been always using the Wired, and we've recently transitioned to the Wired 4. So that's from here, that is where we will get the range of literacy skills from single word to passage level. And for phonological processing, we would use something like the CTOP, or the Comprehensive Test of Phonological Processing. So that's where we will get our phonological awareness as well as our rapid naming measures. Okay, so I think especially with the pandemic, there was a lot of attention to conducting tele assessments. Okay, so so after gathering a lot of information from different test publishers like Pearson, so this is so I've gotten this information from the Pearson website, where there are several considerations when it comes to tele assessments. So it is because many of the test kits, like what I showed earlier, are standardized based on face-to-face administration. Okay, conducting it online in a tele-assessment way it can be considered a deviation from standardized administration. So therefore, there are significant concerns, and I would say particularly if that particular assessment is more high stakes, meaning that the referral question is to ascertain whether there is a learning difficulty, and we are making a decision that would affect the child's schooling in future, etc. So so it's very important, therefore, to us to get as accurate information as possible. And in terms of administering tele assessments, factors that we should consider would be the environment and the equipment available. So things like a stable internet connection, a good mic, as well as a good speaker are things that, and also environments such as, whether the outside of the room, is it a noisy environment? Is it conducive to conduct an assessment? Are there distractions that are there, Some other things might be assessment materials and procedures. How do we get some materials over to the client or the student? Some examinee considerations, whether there are other difficulties that the student is experiencing that make it difficult for them to access a tele assessment. Okay, examiner considerations. So whether the examiner is will be able to has the ability to kind of assess the surroundings and be sensitive to things that are happening over at the end of the examinee. Okay, and also report writing. How are we going to incorporate this in the report? How does it impact the eventual conclusion? So all these things are very important considerations when thinking of conducting assessments. So so for us in Singapore, because the country is small, we don't really there is no like a barrier in terms of accessing our students and our clients. So we do have to weigh that, the accessibility of the clients and the accessibility of the examiner versus the compromises that we are making when we are doing a tele-administered assessment. Okay, so this is just a note on that. Okay, so after we have completed the testing, we have gathered the information, we will consolidate all these into a psychological report. So so as mentioned earlier, some of our assessments are conducted by our specialist psychologists, and we do have a process in which there will be vetting of the reports written by all the psychologists, be it by their peers or their supervisors. Okay, and components of our report would be, we will definitely have a reason for referral, why the client came for an assessment. We would cover some background essential information, detailed behavioral observations when we are seeing the child. We will explain the cognitive assessment results, phonological processing results, as well as the literacy assessment. Okay. Finally, we will talk about the conclusion, recommendations, and include the technical appendix with the scores. Okay, so in terms of the summary, it's not apparent, it's not something that we include that many other psychologists would include, but for DAS we do. Okay, so I think somebody raised their hand. Is there a question? No? Okay. Okay, so I know that there are some questions that were listed in the chat already. I think we will, oh, okay.
We will take it in, ma'am.
Yeah,
We'll take those at the end.
somebody will ask you these questions.
Yes, yes.
At the end, we will address the questions. We have
Yes.
time for that. Somebody
Yeah. So I think that the questions are collected on the chat. Yeah, we will certainly cover them later. Okay. Okay. So that is our psychological report. Okay. So we are almost to the Esther will cover the next part, and we are almost at the end after this case study, and then maybe we can look forward to more detailed discussions. Okay. All right.
Yep. Okay. So I'll be walking us through a case study to give us an example of what the process will be like for an assessment client of the DAS. We're going to be looking at a hypothetical profile, and it will be this girl called Kelly. So Kelly is a primary 2 or a grade 2 student. She's 8 years old and 8 months, 8 years and 8 months old. So for Kelly, her parents and teachers notice things such as her struggles to keep up with homework and exams. She finds activities like spelling, reading, copying very difficult, and she also tends to be rather disinterested in her lessons at school. So aside from these observations of Kelly, in the next slide, we see that Kelly's teachers also observe that her academic performance seems weaker than her peers, and she's also easily distracted in class. Her mother noticed Kelly tends to take a long time to finish her homework, and that she seems to be making copying errors again and again. To make matters worse, the tuition programs that she assigned Kelly up for doesn't seem to be benefiting her at all. So in view of all these concerns, Kelly's parents decided to send her for a dyslexia screening at the DAS. So Kelly comes and she sits for the mass screening procedure, which is the computerized test, where the results indicated that she is at high risk of dyslexia. So now to confirm whether she's indeed dyslexic, Kelly's parents decide to sign her up for an assessment. Prior to the assessment session, the DAS psychologist will gather information from Kelly's parents and teachers. On top of collecting feedback about the difficulties they see in her, they will also ask about some important areas such as her family background. For instance, we want to find out a little bit more about Kelly's exposure to English at home and whether there's any history of learning difficulties in the family. So for our hypothetical case, Kelly, we will take note that she grew up in an English-speaking environment and that her older brother has been diagnosed with dyslexia. Next, the psychologist will also look into her medical and developmental histories, on the previous slide, to find out if there has been any conditions or delays that have affected her reading. So fortunately for Kelly, her histories in these areas are rather uneventful. And then we will also look at her educational background and the amount of support she has received in the areas that she is reportedly having difficulties in. For Kelly, we assume that she has been attending school regularly since she was in preschool, and she has even had an additional 2 years of extra classes in her literacy and in her phonics to support her in those areas. So following the information gathering session, we'll proceed on to the actual assessment session where the psychologist will meet Kelly and administer the test. But during the session, the psychologist will also take note of Kelly's behaviors and comment on areas in the report comment on areas such as any communication difficulties, any attentional difficulties that might affect the reliability of the results. So it will be important that Kelly is able to comprehend what she's required to do during the testing session, and that she's able to communicate her answers. Her attention and her motivation levels on the task will also influence the interpretability of the results. So once again, for our hypothetical case, we will assume that she faced no difficulties in these areas and that the results that we are going to look at are going to be a reliable indicator of her abilities. Okay, so when we go on to the next slide, we'll see the result. Like what Pei mentioned, our dyslexia assessments will cover three main areas: the cognitive assessment, phonological processing, and the literacy assessment. So here's a snapshot of Kelly's results on the cognitive test using the WISC-5. So we find that she has generally adequate cognitive abilities for her age, apart from slow processing speed, as we see on the left, indicated by her processing speed index score. And she also happens to have very weak auditory working memory, which we see on the right, as indicated by her digit span subtest score. Apart from this, her cognitive abilities are generally adequate. Next, we will have the phonological test. So this looks at her phonological awareness and her word retrieval fluency on the CTOP2. And on both of these fronts, Kelly is showing quite some weaknesses. Then lastly, we will have the literacy test. So Kelly showed generally weak to very weak skills across all aspects of literacy measured. So be it reading, spelling, writing sentences, she all showed below average to low skills. It was only her listening comprehension, which was the more of a language aspect, that she managed to obtain an adequate performance. So for young children, we also sometimes administer an informal writing test to obtain more information regarding their writing skills. On the right, that's what we will see. It's a sample of Kelly's work. So she was shown a picture and then informally asked to write a few sentences about the picture independently. Okay, so what Kelly meant to write is, I was going to the zoo and I see two boys feeding the animals. I see a writing said, do not feed animals. I see a little girl riding a horse. And from the writing, we can observe that Kelly, she's making letter reversals, and her written expression is being impaired by difficulties in spelling, in punctuation, capitalization, and grammar. Some important things that we'll note is also her handwriting does seem to have to be a bit weak. It's not quite adhering to the lines. The letter formation, sizing, spacing all appear to be rather inconsistent. Okay, so then overall, what we observe in Kelly's profile is that she has weak to very weak literacy and phonological skills, as well as accompanying weaknesses in areas that are commonly implicated in dyslexia. That is her verbal working memory as well as her processing speed. So these difficulties cannot be accounted for by any other causes, such as intellectual impairment, because we saw that she has generally adequate cognitive abilities. She also did not have a lack of educational opportunities that would contribute to her underachieving in these areas. So when we take into consideration all of these factors, even with the factor of her having a family history of dyslexia, we can conclude that there is sufficient evidence to diagnose Kelly with dyslexia. So following the assessment and the conclusion, we will also proceed to make some recommendations and share them with her parents. So some important areas are referrals. So one area is to refer her for intervention. So in view of her dyslexia, we would recommend her for specialized literacy intervention. This is a program that we do provide in the DAS, although it's also available in other private centers in Singapore. So this will be important for her to work on her literacy weaknesses, phonological weaknesses. And in view of the attention concerns, as well as the difficulties in handwriting, we will also recommend Kelly for occupational therapy, where the therapist there will be able to work with her on some strategies to remediate these areas. Okay, then next, apart from the referrals, we will also recommend school-related accommodations for her. So one area is access arrangements. So we might recommend for her to be granted extra time in her examinations as well as a reader to compensate for the dyslexic difficulties that she experiences. We will also recommend some further support from the school, such as the having an allied educator to help her. So an allied educator is a position in the school staff who work specifically with children or students who are facing difficulties in their learning. So we recommend for the AED to do things like revising reading and spelling of sight words with Kelly, and as well as to teach her attentional skills to help her focus better in class and optimize her learning. We also include some classroom strategies in the report. These are strategies that Kelly's teachers can refer to help her in the classroom. So things like reducing copying demands, giving her maybe outlines so that she doesn't have to copy so much and struggle with that. Letting her sit nearer to the teacher in the classroom so that she's able to ask questions more easily, or the teacher can check on her more easily. And also just giving her a bit more understanding and time when it comes to reading and writing assignments. Okay, next, we will also include some home strategies for Kelly and her parents, things that they can do at home to help Kelly improve in her areas of weaknesses. For literacy, it will be some of the ones that are listed on the slides, using games, pet reading. In terms of her handwriting, we'll recommend some multisensory methods and maybe some exercises also to strengthen the hand muscles and hand-eye coordination. And then lastly, in attention, a visual schedule we might recommend to help her be able to manage her attention while she's doing revision and homework at home. Okay, so following all of these recommendations, ideally, this is what we expect will happen for Kelly, assuming all the interventions have been put in place. We will expect that her literacy skills will improve after attending intervention. We also expect that her inattentiveness she'll be better able to focus after receiving occupational therapy. It's also possible that the inattentiveness that was reported earlier may be secondary to her learning difficulties. So once that has been addressed and some support has been put in there, that her attention difficulties will be greatly reduced as well. We also might ideally expect to see that Kelly will cope better in school now, and that there will be some more positive feedback regarding her learning and her attention. So this is really why it's so important for us to be able to have an assessment to identify the child's learning profile. So with this in place, we can help them to learn more happily and more effectively. Okay, so that will be the end of our presentation. There are some questions that we've seen in the chat. I think, Pei Yi, we will just begin to address the questions.
Yeah. Okay, just let me take a look.
Yes, ma'am. So thank you so much, Ms. Fong and Ms. Lam. That was indeed a great session. And now, like you rightly said, there are indeed some questions in the chat box. So I would request Ms. Jovia Rose Joy, who is an FYBH student of Hashu Advani College of Special Education, to please take it ahead. So over to you, Jovia.
Thank you, Rajalakshmi ma'am. We are thoroughly grateful to Fong ma'am and Lam ma'am for presenting an enlightening session for us. So now we'll be taking the questions that have come in the chat box. I'll be reading them out. The first question, at what age are the assessments conducted?
Okay, so for us, for school readiness assessments, we would conduct for preschoolers 5 or 6 years old. For dyslexia assessments, we will conduct them for children starting from 6 years old. And for all others, we would typically conduct the assessments at 7 years old. I think there are some of the considerations when it comes to thinking about when we start doing an assessment. Come on. For a child is whether they have had adequate exposure to learning. or some form of intervention. So for many learning difficulties, it's very important to I think when we are looking at things like the Diagnostic and Statistical Manual, like the DSM-5, for many learning difficulties, we need to ensure that the child has had, we need to consider the educational opportunities that the child has had. So having adequate schooling, adequate learning support, those are essential. So because in Singapore, many students, they start their formal education at 7, and majority of the students also have some form of education at the preschool level when they are 5 and 6. So that's why we have this minimum age range minimum age for the assessments. Okay.
Thank you, ma'am. We'll move on to the second question. Which are the areas covered under the school readiness assessment?
Oh, okay. So school readiness assessments, right? There are different components, and they might be included under different circumstances. So we may include so we are very likely to include an IQ test, so a cognitive test to kind of see how the child is developing in terms of reasoning skills, processing speed, and working memory, etc. Okay, so that one is something that we will definitely include. We would cover a little bit of basic kind of literacy and numeracy skills. And so things like, very basic literacy, alphabet knowledge, a little bit of word knowledge, reading, as well as a bit of counting. So those are things that we may expect a student at the preschool level be able to know. And if there are concerns for like more general learning concerns, we would include a test of adaptive functioning. So a child's ability to function daily, to be able to communicate well on a day-to-day basis, be able to be independent and take care of themselves. So those are the things that we would include we may include in a school readiness assessment.
Thank you, ma'am. Moving on to the next question. How are assessments conducted on a child having dyslexia along with other disabilities?
Okay. Okay, so let me see. If there are other difficulties, then we would definitely take them into consideration, and I think it's highly dependent on what are the additional difficulties, right? We would ensure. So, say for example, maybe Esther, you can add on a little bit if I missed out anything. So if I give you an example, someone who has a co-occurring attention ADHD. So a child might be presenting with learning difficulties in reading and spelling and writing. So that might point to dyslexia, but they also exhibit attention problems and either suspected or have been diagnosed with ADHD. Then if it's behavior in nature, then the conduct of the assessment, we might want to make sure that there are sufficient breaks to ensure that the child is attentive, and at the same time to ensure that the child can pay adequate attention for whatever they're doing, so that we can get an adequate like a good measure. Apart from that, some students may have also been diagnosed with ADHD already, and they might be, say for example, taking medication in cases where it would help them focus a bit better. Then we would ask to ensure that the child has taken their medication prior to the assessment, to ensure that the behavior aspect does not affect as far as possible the measures that we take on the other areas lah. Okay.
Thank you, ma'am. Moving on to the next question. So are there any standardized tools to conduct school readiness assessments?
Yes. So for school readiness assessments, so like for the Wechsler family of IQ tests, they have just now I mentioned the WIS5, the Wechsler Intelligence Scale for Children. There's also the Wechsler for preschool, the WIPSI. So it can go. So you'll notice that the like IQ tests themselves will go as low as maybe even 2 years old. And sometimes for literacy tests and literacy measures, right, they go down to as low as possibly even 5 or 6 years old. So there are standardized tests that are available for testing preschoolers.
Thank you, ma'am. Now we'll take another question.
Sure.
The cost of the assessments are on the government takes the cost, or the parent has to pay for the assessments?
Okay, so it's a mixture. So parents, so largely speaking, parents may pay for their would pay for the assessments, but there is fundraising. So for example, for DS, we do fundraising, and because we are not for profit, we do provide bursaries for families who require it.
Thank you, ma'am. Moving on to the next question. What kind of setup do you have in Singapore? In a sense, is that are there more inclusive schools, or are there more general schools?
Okay, so for us, majority of the schools are ministry affiliated to Ministry of Education. So I think earlier on in the presentation, I mentioned about the differences between mild SEN and maybe more severe types. So for our mainstream schools, we do have those students with mild SEN can continue to access mainstream education in mainstream schools. So there are provisions for inclusivity, so meaning that the schools would have programs available for students with mild SEN, have learning support. So like Esther also mentioned earlier about the allied educators. So those are people who are supporting students with learning difficulties in schools, in the mainstream schools. Separately, for more specialized schools, we have more special schools. We have special schools for students with more general learning difficulties, and that's when mainstream education might be too much of a challenge for them, and the special schools will focus on other areas.
Thank you, ma'am. We'll be addressing another question.
Sure.
How long does the assessment take, and how many tests are done in a day on an individual?
Esther, you can take that.
Sure. A full assessment process will usually take 3 to 4 hours on average. Typically, we'll administer the tests that we've covered earlier, for example, in Kelly's case study. So all the cognitive tests, the phonological test, the literacy test, as much as possible, we'll try to complete them within that 3 to 4 hour session with the child. Understandably, sometimes there are young kids who come in about 6, 7 years old, and if they have some difficulties sitting through that long session, for example, they might start getting very tired, very distracted, then we might break it into 2 sessions conducted over maybe 2 separate days, but we'll administer all those tests.
Thank you, ma'am. There's another question. So what is the role of a special educator when it comes to the assessments conducted by a psychologist?
Okay, so I think for following the assessment conducted by psychologists, there is a written report. So within the so I'll speak for the DS a little bit first, in that we have colleagues who are providing literacy intervention for students with dyslexia. So they will review the report to try and understand, a little bit about the background of the student that they are taking on, as well as some of their strengths and weaknesses. So having this, that's how the information about our child is translates to the professional who is working with them. So and at the same time, we've also gone over like information gathering process as part of the assessment. So the educators themselves will also have they are also key characters in a child's learning, and they can provide some good information about the child's progress that can inform, say, a review assessment later on. So I think psychologists do very much like to work with those that are those who are working with the child, because at least for us, we are seeing the children, you know, at the point of assessment only, and being able to have that conversation with educators are also something that is quite valuable.
Thank you, ma'am.
Mhm.
There's one last question.
Mm.
Someone has asked about the technical appendix. What exactly is the technical appendix?
Okay. So let me share screen and then I'll show you. Okay. Okay. So let me try to. Okay, so something like this, a technical appendix will have the scores that are, will summarize the scores that were obtained during the test session. Okay, so that's the technical appendix, and we will, so we would attach a list of scores for the that were based on the assessment, the testing session itself, and we will refer to it in the report line itself. Okay.
Thank you, ma'am.
No
we
problem.
are done with all the questions. The session was really good. We extend our sincere gratitude to both our resource persons, Ms. Fong ma'am and Ms. Lam ma'am, for clearing our doubts and elevating our understanding. Thank you once again, ma'am. Now
Okay,
I hand over.
much.
Welcome. I hand over to Rajalakshmi ma'am to proceed with the event.
Thank you so much, Ms. Jovia, and thank you, Ms. Fong and Ms. Lam, for all your patience in answering all the questions that the participants had put forth. I now request and invite Manjushri Patil ma'am, the founder of Atman Academy, to kindly sum up the entire session and give the vote of thanks. So over to you, Manjushri ma'am.
I'm unable to start my video.
That is okay. You can speak, right? You can unmute yourself, right? That is more important.
Okay. Right. Okay. Thank you. You want me to keep the video off? Is it okay?
Yeah, better now. We can see you. We can hear you.
Okay. A very good afternoon to one and all, and especially to you, to both of the lovely speakers. I must say, I'm going to completely agree with what Jovia said. You have really elevated our understanding of a lot of things today. And I'm going to quickly point out to a couple of things that have struck me. I've kind of starred them when I was taking down notes from your session. Thank you for giving us an overview of what DAS does, because with the world shrinking today, it had come up even in the earlier session that we have these services and we can now actually avail of the facilities when we know of kids who are there. So thank you for that. I want to particularly draw attention, I'm sure everybody has seen, has really liked that, the concept of screening and the concept of assessment that you have shared. I love the fact that you said screening is like a snapshot and a photograph, and assessment is like looking at a child under the microscope. That is an amazing analogy, and thank you so much for that. Definitely, I'm going to say that all the concepts that you shared with the flow of how testing, the computerized screening happens. We'd love to know more about it. And I mean, now we have your mail IDs. We'd love to connect with you as we go along. And I'm also going to say that one of the things that you did that was very new for all of us is that you threw light on tele-assessments. Because tele-assessments...
Video, because then the connectivity will be better. Yeah, and the audio will be clearer. Thank you so much.
Sure. Tele-assessments were very well described, because we love the fact that you've given us an idea of what can be right, what can be wrong, and a word of caution about tele-assessments. And finally, your case study that was so beautifully narrated in the form of a story, and especially the fact that you gave us this beautiful slide of few years later, the scenario that will happen after a couple of years. So that was something that gave us deeper inside. So a very, very big thank you to you, PE, and to you, Esther, for this wonderful session. We're going back definitely a lot more recharged with your learnings. And a big thank you to Hashu Advani College of Special Education for this amazing conference under the guidance of Dr. Asmita. Thank you so much. You guys are amazing. You're incredible to have put these 3 days together. We see the sweat and the hard work that has gone behind all of this. God bless you all. Thank you so much.
Thank you so much, Manjushri Patil ma'am, for summing up the entire session so beautifully and for your vote of thanks. So please note that the recording stops here.